Hi, this is page 1311. I'm going to be talking about geriatric nursing. I'd like to introduce my audience. Geriatric nursing has come a long ways. A lot of people thought that most of the nurses that work on that field don't get enough exposure, but as things have changed and evolved as the years gone by, and we most of the nurses do get to do a lot of things as far as the skills are concerned. Um, a question that is thrown out there with most people is that do you really know what goes on as a nurse, what goes on as a geriatric nurse, what really happens in geriatric nursing. Most people are unaware or are ignorant to find out what really a geriatric nurse responsibilities are. Um, that is a side of nursing that really doesn't get to be explored, and you find most people just have just kind of overlook it. And but it has evolved and it has come a long way, and it is one of the fields that if I was to advise anybody to go into and have some sanity, that's the type of nursing that I would advise somebody to go to. Geriatric nursing has its own diagnoses that are major that we have to deal with on a day-to-day basis. Some of the things that with the population that we handle that we normally get to see diseases to deal with the skeletal system, circulatory system, and the central nervous system. Those are the three major diseases that most of the geriatric nurses get to handle. So when it comes to the skeletal system, you get some diseases like osteoporosis, which lead to fractures. And when you have to deal with fractures, you're dealing with treatment, rehabilitation. That means that those patients are not capable of taking care of themselves at home, which would require a skilled personnel to have to assist them with their day-to-day. Um, Places like nursing homes have become a norm for most people aged 65 years and older. when they when they're incapable of taking care of them because of a disability like a hip fracture, they find themselves in a nursing home, of which where they get to have the nursing side of it, which is medication administration. If the person has had a hip fracture, that means they'll get rehabilitation. They'll get the treatment due to the incision site where the repair was performed, and therefore they recuperate and they're able to go back to their activities of daily living back home. When it comes to things like circulatory issues, we're dealing with things like people getting heart attacks, and then they're not capable of going back home and taking care of themselves. So they'll need a little bit of rehabbing, a little bit of exercise, and to get their strength back to where they were before. They'll need a little bit of more monitoring, and most people really can't afford being in a hospital for that longer period of time. They prefer coming to a long-term care setting or a short-term care setting like a nursing home, where they get the rehab uh, done on them, and they get the whole activities of daily living are done for them and provided for them on a timely manner, schedule. It's scheduled, therefore they don't really have to worry about those things, and really concentrate on getting better and just recuperating so that they can be able to go back home. Things like I said, medication administration, um, their food, their clothing, all of that is taken care of. But when it comes to the nursing side of it, the teaching is there, because once you get a heart attack, that is something that is totally new to you. You've never had a heart attack before. Um, when it comes to the nursing side of it, the teaching is provided for them, the medication is provided for them. They're taught about the medication, how to administer it, what to do before taking that particular medication. So, and most of these, the age group of people that are in the geriatric community, you'll find that their loved ones or their kids, their grandkids are not close by. So the geriatric nurses become part of their life, and that they're able to guide them through the process of getting better, and able to go back home and going back to their daily day to day. When it comes to the central nervous system, we're talking about most patients have strokes. They'll have things like short-term memory loss and all these things. Um, that has become the major, or the one of the key things that happen with this age group of people, the geriatric community. So geriatric nurses have become very useful, because you'll find that most families or most loved ones do not really understand what's going on with that particular person, if it's their mother, their father. So the geriatric nurses, you'll find that they'll provide the teaching, they'll provide the guidance, so that they understand the disease process of what's going on with this particular person, and they're able to understand, at the end of it, accept where the disease is coming from, and what they are going to be experiencing moving forward. Um, like I said initially, geriatric nurse has evolved. It has become the major part of the major part of with the baby boomers that are coming and retiring right now. It has become a really sought out career right now, and it's an experience that most people should really um, look out to see if they want to join that part of nursing. Um, I hope that I was able to inform you and give you some insight on what geriatric nurses do get to experience in this timeline, and hopefully you'll be able to look at it in a different form. I would like to introduce my audience. To show you my audience again, and I thank you for listening to me.